Today, we are reporting 761 new cases of COVID-19 diagnosed in British Columbia, bringing our total number of people with COVID-19 to 56,015. Of the new cases, 94 people are in the Vancouver Coastal Health Region, 484 people reside in the Fraser Health Region, 23 people are on the Vancouver Island Health Region, 96 people in Interior Health, and 64 people in the Northern Health Region. We now have 6,349 active cases in all areas of British Columbia. 372 people are in hospitals, 74 of whom are in critical care or ICU. In addition, there are 8,849 people, plus some additional from Northern Health who are under public health monitoring. And 47,374 people are now considered recovered. Sadly, we've had an additional 8 new deaths from COVID-19 in the past 24 hours. All of them are seniors and elders from long-term care in Fraser Health, in Vancouver Coastal, and in Interior Health. That brings the total number of people in British Columbia who've died from COVID-19 to 970. And our condolences go out to the families of these 8 people and all of our people who have died from COVID-19. We know that their families, their care providers, and their communities mourn the loss of their loved ones, and we feel your loss as well. We have one new healthcare outbreak at the Sasalwatul Lalem long-term care home in the Island Health area, giving us 51 active outbreaks in long-term care and assisted living and 10 in acute care. That involves 2,333 people, 1,501 residents, and 752 staff with active cases right now. Since the start of our immunization program, we've now, as of yesterday, have provided vaccine to 41,064 people in every health region across British Columbia. As we know, the burden of COVID-19 has been particularly heavy on our seniors and elders and those who care for them. And that is where our focus has been and will continue to be for the next week or two here in British Columbia as we use the vaccine that we receive. And we're going to continue to focus, as we say, to try and protect those who are most at risk in these first few weeks with the limited supply that we have. And we will be expanding that, as we talked about on Monday, as supply becomes available to ensure that we can protect as many people as possible, as quickly as possible. I also wanted to give an update on the UK variant that we reported on our first detection of somebody who had traveled from the UK into British Columbia with that variant. That person has remained in isolation. However, we have now 2 additional cases, both household contacts of the first case. There are no other contacts, and we do not believe that anybody else is at risk of this variant. And I will also say that we have been continuing to do surveillance and testing of isolates from people who have traveled, and also a selection of people from around the province on an ongoing basis. So we have not yet found any other cases in BC with this variant, although we continue to monitor and to test. So today, there was a couple of things that happened. There will be... from the first time we've had COVID-19 cases almost a year ago in our province, we've tried our best to share the latest information about the pandemic. We know it's important. It allows all of us to understand how we are progressing, how the pandemic is affecting us, and the trends we are developing, so we can make our own informed choices about our personal actions and the actions that we are doing collectively. Over the past few weeks, we have been trying to automate at least some areas of the collection and reporting of our daily case numbers. As a result, there will be some changes to how the data will be reported going forward, to streamline one aspect of what is a challenging, complex, and labor-intensive process. And you will recall in early December and in November, we've had some challenges with new information systems being come online, with some applications and challenges in reconciling numbers from different health authorities. Our new system is going to be based on automatically reporting lab-confirmed cases from the previous day, plus reconciling with the health authority cases, particularly epidemiologically linked cases, to provide more timely reporting of data. So as you know, the BC CDC dashboard and data tables are our source of truth, and they are where all the corrected information will go. And they will now start being reporting by our lab result date. So this is a bit technical, but for those people who are following this closely, most of our epi curve on the dashboard has been by what we call reported date. So that's the date that the health authority receives that report and starts the investigation on that individual case. They then pass that information back to the BC CDC to provide the provincial level update and consolidation of numbers. So we're now doing it, we're taking away one piece of that and having the lab report both to the health authority and to BC CDC directly, so that we can have a more timely reporting of the lab cases. There will be an adjustment in tables to reflect the fact that the lab results may be slightly more, it may come on a different day than what the reported result is. Usually it's within a day or two. So there'll be slight changes, and we're gone back and moved all of the cases from January of 2020 up until today onto this new lab reported date. So for those who have been looking at the epi curves and our 7-day rolling average on an ongoing basis, it will look slightly different, where some of the numbers moving backwards or forwards by a day or two. There also is a slight increase that we've seen in case counts today and for a few days as the new system kicks in, and the previous lag that we used to have from positive result to reported case is eliminated. So as we know, every day the numbers are from a time, a cutoff. They're a snapshot in time, and they get updated and verified and corrected as more information comes in. And as so, there will continue to be fluctuations in our numbers as cases are verified. So, for example, if a case is reported in Interior Health today, and then we find out it actually is a person who comes from another province, that case would be removed. That's why it is important for us to also pay attention to our trends over time, the 7-day rolling average being the one that we watch very carefully. And the daily case count, as I said, is just a snapshot, but that rolling average helps us understand our trends as we're moving along. Importantly, what remains the same is every case is still counted. And every person who's positive is still notified as soon as possible, and contact tracing and follow-up, and particularly to identify new clusters and outbreaks, continues as usual. In addition to the daily reporting, we will be continuing with a number of weekly reports and adding 2 new reports. So as you know, we provide our PPE report, the surgical renewal, and the healthcare hiring report. Our weekly surveillance report from BC CDC comes out on Wednesdays, and that has the details around ages and some of the epidemiologic information broken down by health authority, the granular information by local health area, etc. And also we'll be adding weekly vaccine updates by health authority and a summary of long-term care outbreaks, which came out today. Are you going to talk to that? Yeah, okay. I think I know people are wondering what is going to happen, and like every part of Canada and countries around the world, the risk of spread of COVID-19 remains very high right now. And we are seeing new cases and clusters and outbreaks emerging around British Columbia, around Canada, and around the world. Here in BC, we continue to monitor our pandemic, and we will continue to do all we can to protect our province, as we always have been. In the last days, we have seen a slight increase in our cases, and our curve is trending upward. Now is our time to stay the course. We know what we need to do to bend that curve back down. We have been successful in doing that prior to this winter break, and we need to do that again. As a result, our current provincial health officer orders on all gatherings and events have been extended through to February 5th, 2021 at midnight. This means that the same requirements that we have had, including restrictions on social gatherings in people's homes, on all events in public venues and private venues, and the restrictions on sports activities, continue to apply. We are closely monitoring our progress, and if further action is required, we will take that. If we see positive trends in our cases and our hospitalizations, and we see a lessening of our impacts, we will monitor that as well. Right now, we need to hold the line. Our public health orders for the next 2 incubation periods are important to ensure we are doing all we can to keep everyone in our province as safe as possible, especially now that we have vaccine. We are in this period of greatest risk and greatest potential benefit, and we need to have the room to provide vaccine. These orders enable our healthcare system, our schools, our essential workplaces to continue to stay open. This is important for all of us, for our mental, physical, and emotional health. We know that transmission is less likely to occur in these controlled environments that have their many layers of protection in place. It's what we do outside of these environments, outside of our home and in our homes and workplaces, that is a concern. We know the vast majority of people in British Columbia are doing the right thing. And we saw that with many people who put aside their celebrations and travel over the holiday season. However, the number of new cases we are seeing in every health authority shows us that some people made the decision to make an exception for themselves. It may seem inconsequential. It may not have been done with the understanding of the impact it could have. But if 10,000 people, a few people in every town, every village or city in our province, makes these small concessions for themselves, that increases all of our risk exponentially. That's why, no matter how tired we are, we must stop and rethink and redouble our efforts now. This virus doesn't know that we haven't seen our friends in months. It doesn't know that it's our grandmother's birthday. It doesn't know when we let our guard down, it's transmitted. And it's not intent. And this is what we are seeing now. Things like gathering for lunch at work with people you work with, small parties with friends who've just returned from Europe. The virus reminds us how interconnected we are, and we have seen this over the past year. This is a global pandemic. A variant that arises in the UK affects us. Surges in Quebec, in Ontario, in our neighbors in Washington State and Alberta affect us. But our pandemic is unique, and we know what we need to do in BC. This is our riskiest time right now. We cannot let our guard down, as vaccine is just beginning. This is our winter, but we know that spring will come. Right now, I want everybody to reach out virtually to support each other. We need to protect our seniors and elders, even as we're moving along with our immunization program. But it's a time for each of us to commit to our own individual heroism, young and old, and I know we can do this. We can do this because it makes a difference for our family, for our community, and for our province. And we do this here in BC with compassion. We go outside, we walk together, we support each other, we go for a distance walk with our neighbor or our friends. It's compassion and understanding that we need now to get us through these dark days. We can all look forward to that end that is in sight, and it is in sight. But we must act now to get there sooner and to protect those we care about and to protect those we don't know. Without a doubt, there are brighter days ahead, where thousands more will be immunized for COVID-19, the weather will be warmer, and the spread of the virus will be slowed. But now we need to work together, knowing that what we do will make a difference for all of us tomorrow. The actions you take today make a difference. And I want everybody to take those actions that we need to do to support each other. We need to go out, do something kind for somebody. Make an effort to support those people in your community who are suffering. We know this time of year is challenging. We know that people need support. And we know that it's going to be a while until we can get back to the types of activities that we really want to do. We need to continue to be kind to each other. We need to have that compassion, to recognize we don't know everybody's story, and to stay calm. And that's what will keep us safe through this winter.